All right, well, welcome to TPR's Mucho Gusto in conjunction with all these fine organizations that we have here today. My name is Joey Palacios. I'm the local government reporter for Texas Public Radio and routinely cover the city as well as its many departments, including the Department of Human Services. And today we are going to be talking about the results of the Teen Mental Health Survey. And so we're really excited to welcome these four people up here, and I'd like to introduce everybody one by one. Immediately over here to my left is Jem Morris. He's a management analyst with the Department of Human Services. We also have Michael Valdez, who is a dual member for the San Antonio Youth Commission and Project Worth Teen Ambassador. Emerald Alaniz, who is also a dual member for the San Antonio Youth Commission and Project Worth Teen Ambassador. And Melissa Tijerina, Vice President of Children's Behavioral Health. We're very excited to have y'all up here today. And so I wanted to start with a little bit of introductions. So Jem, why don't you tell us what you do at the Department of Human Services for the city?
Yeah, absolutely. So as a management analyst with youth success, we mainly focus with high school through college age students. And my role is also to be I have the honor and privilege of being the commission liaison. So I get to work and basically help schedule all the meetings and do the back-end work from the city to help our youth commission, and then our higher education student advisory board, which is for college students, as well as our commission on education, which is for adults interested in helping improve college and career readiness across the city.
Okay. And so Michael, tell us how you got involved with the San Antonio Youth Commission.
I got involved with the San Antonio Youth Commission during COVID. I applied online on the board and commission's website, and I had an interview with my councilwoman, and I got appointed for District 6 on the Youth Commission.
And it was a pretty cool accomplishment for both of y'all to be, appointed by a council member to this. So, I mean, obviously this is something that y'all are very passionate about. And Emerald, how did you get involved?
Hi, I got involved through the same way as Michael. I applied online, and I know I lived in District 5, and I was very passionate about my community, and I've always wanted to support my community in any way I can.
And could both of y'all tell me a bit about Project Worth? What exactly is that? And for folks out here, and tell us, what the mission is.
Our mission for Project Worth is we're youth in the city of San Antonio through the Metro Health Department, and we have our several initiatives. I Dream SA, and I Dream SA. What's our other initiative?
I Dream SA is a website that anyone can publicly use. It has different things for the community, mainly focusing on teens, whether that be through the arts, careers, higher education, health and well-being, and different resources we have.
We also are teen ambassadors, so we have a lot of team building. We volunteer in the community, and we just make an impact in our community.
That's amazing. The sky is the limit. Since y'all are starting so young at this, I mean, the sky is the absolute limit for y'all. So I'm very proud of you. And so, Melissa, tell us about children's behavioral health and your role there.
Sure. So I work for the Center for Healthcare Services. We're the local mental health authority, and so we provide services to children ages 3 to 18 plus. And I say 18 plus because a lot of young people have not graduated high school, even though they may have turned 18. And so we want to continue to provide services to those folks before they move over to adult services if that needs to happen. And so we provide a lot of different services, mental health services. We assess for substance use challenges, and then we also provide early childhood services. And also we provide crisis response. So to any young person who's in Bexar County experiencing a mental health crisis, we have a team or individuals that we can deploy to help those individuals.
So before we get into the conversation, I wanted to recap some of the results that we just saw in that video. There were just about 850 people, 846 specifically, who completed and responded to the survey. And out of everybody that had responded, 37% had said that they had an inability to perform day-to-day tasks when they were asked about depressive traits. About half said that they felt helpless, hopeless, numb, or like nothing matters. And 24% said that they started smoking, vaping, or using drugs. While LGBTQ plus and gender diverse youth represented about 20%, reported 20% percentage points higher on average than their heterosexual counterparts when reporting the inability to perform day-to-day tasks of feeling helpless, hopeless, numb, or like nothing matters. So Jem and Melissa, I wanted to ask both of y'all, and Jem, we'll start with you. Why did the city feel like that this survey was necessary? What was triggering that this needed to be explored and see how people were feeling?
So this all came about in our youth commission's first meeting. We met in November, and this is led by the youth, and our role as a city is to listen to what they find important. And so when they first met, we asked them, what did you want to focus on? And one of the things that they had noticed is that there was an uptick in vaping and substance use in the schools. And so it started from there, but we were a small group of about like 12 at that time. And they were saying these 12 can't necessarily get a full grasp of the situation going on in schools. We know it's tough, so they wanted to do some more information gathering. And from there, they recommended that the city launch a survey to get a better understanding of what the needs were and what we could do better.
And Michael, I want to ask you, why was this important to you? Why did you want to feel, why did you feel that this information needed to get out to the public?
This definitely needed to be addressed after COVID. We spent a lot of time at home, so we had a lot of thoughts to ourselves, and launching this survey would gather everyone's input and information on how we can move forward with mental health.
And Emerald, as y'all were getting this survey out to youth, can you talk about some of the ways that maybe you were reaching out to people? Because I'm sure you were talking to some of your peers, wanting to say, like, hey, I know you may have been feeling down, or that you wanted folks that you knew that may have been experiencing this. Can you talk about what it took to get people, like to help get this many people to respond to the survey?
For sure. One of the things I did, I was bothering my friends 24/7, saying, you need to take this survey, it's really impactful, and the city can get good information from this. Then once we got the flyers out, I started pasting them around our school. You would see it on my locker every day. Make sure I'll pass by it and say, hey, scan the QR code, take the survey, it's really impactful. And then I also volunteered at a library. So putting it out there, making sure I go to different libraries and just putting it on the bulletin board, maybe someone would see it. And that was a few ways I did it.
And so, listen, help getting this survey together. Can you tell me like how maybe some of the questions were decided? What were some of the information that y'all were going through to see like this type of, that this question needed to be asked?
I think I'm probably not the best one to answer that. I wasn't part of the survey development, but I can tell you that those questions really lend themselves to what those of us who provide services for mental health find. Those are the questions that will tell us whether people are feeling isolated, if they're having increased episodes of anxiety or depression, and if they're feeling like they know where to go or how to get help.
So, Michael, Emerald, let me ask y'all, in developing some of these questions, what were you using to decide where some of the, where these needed to be addressed?
Some of the things we decided first off was, how do we feel? What questions should we be asking? Because personally, we all have seen a friend or someone we know that's going through a rough time, and being able to relate in that sort was able to get the base questions out, and then we want to see deeper what we wanted for sure information.
Yeah, we also didn't want to overwhelm anyone that was taking the survey, so we worded the questions in a way that won't be overwhelmed and are great to ask, or you can skip it if you want to.
And Jem, can you talk about the process in compiling these results? I know that the survey was launched in March. I believe it closed around in April or so. Yeah. And so when the results came out in late June, what was some of the process that was going on in tallying up all of these responses?
I think that was some of the biggest growth that we had from our city department of processing this, because when we started, we didn't necessarily have a goal of how many we were going to reach, but we just kept seeing the number climb. And the more it climbed, the more attention we saw, and the more the validity, the chance of validity that it had. And so we ended up hitting about 1,047 total, but in terms of valid responses, because we had so many people turn out for it, and these youth commission members and the Project 14 ambassadors did such an incredible job with their grassroots campaigning to get people involved. Our data teams got on board for both Metro Health and from the Department of Human Services, and they are a small but mighty team that were able to filter through it. And what we ended up learning about was not only how a listening project became something that they can get up to a 95% validity rate out of, with a small 4% margin of error, but also how we could work when they are looking for clean and easy binary systems, right? Like, are you in this box or are you in this box? But when it comes to mental health and humans in general, we don't fit in these boxes often. So even with like select all that apply, when it comes to your identities or anything else like that, we had some incredible conversations come from those data teams, and it's actually inspiring them to look at more inclusive manners for how they do city surveys going forward.
And so I know that this is early. The results are less than maybe about a month old or so. What do you see changing potentially within the city, or what type of reaction do you see from the city? And you know, policies and programs, they take time to draft and create, but where do you see some of the direction going in this?
With this, one of the things that we also broke the mold with was, the community engagement office with the city has their demographic questions that they come together, and really it starts at 18 or under. And we had to be like, the majority of the group that we're reaching out to is 12 through 19, so the vast majority of them are going to be 18 and under, so we need to expand that. And I think what they were also able to see is that even though these residents are not of voting age, they still make up a huge part of our population, and there's a lot that can be gained, especially when we're thinking about ARPA funding for youth services or for youth mental health. Why not ask the youth themselves what would be most helpful? And it highlighted so many things that we knew about, but gave them a lot clearer guidance in terms of what could be helpful for them and that bridge of both communities and schools.
So we could see some new outreach programs coming out because of this.
Most definitely.
Okay.
Most definitely.
So let's go back to, let's say, last year or so. This project got started back in November, drafting everything, putting together. A lot has happened since then, but Emerald and Michael, if I could talk to y'all about how mental health became an area of focus for the Youth Commission, and what you remember about the process of putting it together and launching this survey all the way up until when it came out this spring.
Okay, so one of the first things we knew we wanted to talk about mental health is because we're going back to school right after the pandemic happened. Everybody seems like, oh, you got this all together, get everything back together, we're going back to school, get your life together. That kind of mentality really affected us. And those things, we wanted to make sure that adults heard from us. And when making the survey and launching it, we for sure wanted to make sure that we knew youth voices were heard and they can actually make an impact in their community, even if it was through this small survey. We didn't really think it was gonna get this much attention at first. But for sure, the attention it got was really worth pushing everyone to try to do the survey.
And so, Michael, similar question for you. Now, what were you hoping that was going to come out of this? Like, as you were putting this together, what end result were you hoping to see, or what change were you hoping to see?
What we were really hoping to see is the adults listening to us as the youth in the city, especially in the schools. We wanted everyone to know if we have those off days, why we have those off days, and that's because of our mental health.
So, going back to when the pandemic was starting, everybody's lives were upended, uprooted. By the time when most of us were adults, we have our own coping mechanisms, realizing what we have to do to feel better. But for teenagers, a lot of those skills haven't been developed yet. And so it must have felt weird having to go back and forth between virtual school or going back in. And so you were mentioning a moment ago, Emerald, if I can ask, and if y'all of course don't have to share this publicly, but could I ask y'all what some of the challenges y'all were feeling throughout this?
Being isolated, I love being around people. Even if I'm not the most social person ever, I still love being around people. But once quarantine happened, I'm stuck with my family. That's already I love my family to the heart, but sometimes it can be a lot. And with school on top of that, you're just like, okay, sit in front of this computer all day, do the homework, make sure it's due on time, 11:59, no questions. And just learning was really hard overall, and dealing with other third-party problems that was going on at home was also a problem.
And Michael, if I can ask you, so what were some of the things you were feeling, or maybe what some of your friends were feeling from what they were saying?
We were definitely struggling because we had to be home. A lot of us had to find a way to do school if it was online or on paper. Some of us didn't even feel like logging into class. So we were at home, like Emerald said. We were really isolated. Just finding things like to do was the main priority of like taking care of yourself, going out for a walk, or doing something productive.
Now, Melissa, the results of this study, from what we saw, was any of that was it really surprising to you, or was this some of what you as a mental health professional could have been expecting to see?
It wasn't surprising, but it does reaffirm for me that we have folks that are out there that are needing help at any given time. And so we want to make sure that they know how to link themselves to that help, and that they also know that they're not alone. The problem with mental health challenges is you start to feel hopeless and isolated. And the reality of it is you're never alone. It's just having that catalyst to be able to connect with somebody else. But there's always somebody who cares, and I think that we want to make sure our youth know that and know how to make that happen for themselves.
Now, as we go through this conversation, if there are folks in the audience who have any questions, we'll come through periodically to ask. So if there's a question that might be in the back of your mind, start thinking about it, and then part of the way through our conversation, we'll invite y'all to ask what's on your mind. So, a lot of this survey's success came from the grassroots campaigning the young people did, and thanks to the help of many organizations that work with young people in San Antonio, many of which are here with us today. When y'all were promoting participation, were there significant moments or conversations that you could share with us from some of the people when you were talking about this? I know you talked a little about some of your conversations with friends already, but what type of impact or what type of enthusiasm were you seeing from people that wanted to be involved in this?
Personally, I saw very mixed reactions, because sometimes us teens, we don't like to share things like personal. And my friends at first were like, no, I'm not going to tell a survey how I'm feeling, because what if they find out about me? Like, are they going to report me? And one of those things was giving that reassurance where it's nothing like that. If you do need medical help, please reach out. But this survey is just to see overall how you're doing. It's not like you don't have to put anything for certain, like out your name, nothing like that. And just reassuring my friends for sure was one of the biggest things I had to do, because they felt very insecure about how they're feeling. Because maybe, what if someone judges them based off how they're feeling, whether they're struggling or not struggling?
And Michael, did you feel that as well?
Yes, but what I felt really is making sure we had as much participation as we can, because filling out this survey is the first step in having your voice heard in mental health.
Now, from the results, similar to what I asked Melissa a moment ago, were any of the results surprising to you? Was this what you were expecting to see, or were some components maybe much higher than what y'all thought?
The results are what we expected to see. At the end, towards our survey, we had a section to make a comment, right, Jim? And we had a lot of comments about what we know is sometimes our teachers or our parents aren't listening to our mental health, and they say, oh, you're going to be all right, but it's not always that case.
Emma?
Can you repeat the question? I'm so sorry.
So were these results what you were expecting to see? I mean, for you, was there anything that maybe came out that was like really surprising that out of the results?
I think for the most part, the results were pretty exactly what I thought it would be, because I know everyone was struggling. One of the most things that I saw for sure was that even though COVID happened, people were still affected more by school than COVID happening overall. And one of the things that adults really don't think about is how teens focus their life around school. Sometimes we're forced to be this perfect daughter, perfect son, trying to have the best grades, be involved with the community, but behind the scenes is not always the best. You could be struggling even more.
And then throwing a pandemic on that probably must have complicated things a bit. Jen, is there anything that you'd like to add out of what we've heard so far?
No, absolutely. I mean, I think when we were going over the results in our commission meetings, a lot of them did feel kind of like it validated a lot of what they saw with their peers. But I think one of the things that it definitely highlighted for us as the adults in these spaces was the disconnect of youth recognizing that they are most likely going to be the people that they're talking to about mental health challenges, and at least half of them not knowing where to get help from it. And then when we went to the superintendent's meeting, we actually got to kind of present some of the results and reach out to the superintendents at Region 20. There was an unfortunate disconnect, and I think this is both city and in schools, where we recognize that what resources were available weren't necessarily getting the attention or being marketed to the youth that they were for. And so we needed to do a much better job of making sure that we increase the marketing efforts that are specifically targeted towards them, instead of saying, well, the counseling office is there. I don't understand why you didn't go and see the grief counselor that was there, that kind of thing. You know?
So Melissa, since this was put together by the youth, by this commission, I would imagine that it gives a different type of insight than that these questions or this survey may have been put together by adults. So I guess can you talk about how more valuable it is that this was put together by the people that are experiencing it?
Well, I think the main thing is it's the voice of youth. The whole thing is crafted with youth having an input in how the questions are asked, and then it is their voice rather than adults. Most of the time, adults are speaking on behalf of young people, and what you want to hear is from the individuals themselves. What do you need? Not what do your parents or teachers think you need, but what do you need?
Gotcha. And do y'all feel that? Is that with the results that we see with the outcome? Is that something that you feel that from what Melissa was just talking about?
For sure. I know what it is to be like having like a teacher, like a favorite teacher, go up to her, tell her about my day, and she'll go to like another teacher saying, hey, she's struggling a bit in class. And the teacher's always like, well, why didn't she tell me? Why didn't she tell me personally? Sometimes it's hard for that confrontation, but being able to confront either your feelings, schoolwork, anything like that is really important.
So from what I understand, this week y'all completed what's known as Teen Mental Health First Aid Trainings, and that's from the Center for Healthcare Services. Can you talk about some of the takeaways that y'all got from that?
So some of the takeaways is we being the first in part of this training, we noticed anywhere from noticing the signs to how you can lend a hand to your friend.
For sure, one of the biggest things that I took away was like the 1 in 5. 1 in 5 is a big ratio. It's 1 in every 5 people struggle with a mental illness. And that's just documented. That's not like overall for sure. Like, okay, what if the people who aren't documenting this? There could be more. And one of those things is realizing it's okay to struggle, and it's okay to be able to do these trainings to help your friends, help your peers, and help other people in your school or your community.
And so, Melissa, let's talk about what mental health first aid is. What exactly is it?
So mental health first aid is a class, and similar to lots of folks take CPR and first aid. And so that is really taught to people who are not professionals, but the likelihood that they're going to be around a person experiencing an emergency is greater. We're not going to always have professional help available. And so it teaches people how to be that first person when these symptoms are presenting themselves, and how to help guide that person to the professional help that they need, or just give them the support that they may need in that moment. But it's about creating a community of gatekeepers who understand the literacy around mental health, who understand how to talk to people and how to help them find the level of help that they need. And to also just validate that they're not the only ones who feel that way.
And what does mental health first aid look like? Because what I'm thinking about is, when you have the physical first aid, people doing chest compressions or maybe things like the Heimlich maneuver. Forgive me if that's too base of a comparison. But what is somebody who comes out of this training? What are they able to do for someone that could be having a crisis?
So they're taught 5 basic steps to the process. The first of which is making sure that somebody is not actively suicidal or at risk of hurting themselves. because the biggest risk factor related to not having treatment for mental health challenges is suicide. And so we want to first make sure that a person is not in a crisis and that they're safe. Then once that's been determined, then they want to listen. A lot of times people get in a space where they've isolated themselves, they don't feel like they have anyone to talk to. So a mental health person who's been trained in mental health first aid knows to just listen. Give this person an opportunity to tell them what's going on and why they're feeling the way they are. And then talk to them about what some of their options are. What are some of the things that they could do that might help them feel better? And what are some of the times and situations where they might want to seek professional help? And so it's really a step-by-step process where people are taught how to have that communication, because sometimes I think folks are afraid, or like you were talking about, youth and adults don't always communicate the same way. And so in an adult world, sometimes the problems that young people have don't seem that big, but that's only because they've gotten past that point in their life. But if they go back to where they were a young person, they'll remember that the first time you break up in a relationship is a big deal. The first time that you feel like you're disappointing your parents because you're struggling academically is a big deal. The first time you get picked on or feel like you don't belong is a big deal. And so we want to make sure that we're validating how people feel and not trying to tell them how to feel, but allowing them to say how they feel.
So that listening component, I feel like it's such a big part, because a lot of folks, like we saw in the survey, they feel like they don't have somebody to turn to. So what type of impact does that listening, I know you talked a little bit already, but that for someone who wants to intervene and wants to help, how much does just listening to someone help with it? And I know everybody's different, but with that's going through a crisis.
So listening is part of it, because you need to understand. So one of the things we teach in mental health first aid is, have you ever felt this way before? Well, what helped you feel better the last time? Because if people have walked a path before and they found their way through it, then going back and trying some of those things again is helpful. It's a good place to start. The other thing is being able to know when to say, I'm so glad you're talking to me about this, but I think this problem is bigger than the two of us, and we should connect with this person who might be able to help us. And with young people too, I think it's also about, I'm here with you, but I think we need to bring an adult into this equation. And making that okay. Because like you were saying earlier, sometimes it's hard to give that message to this person, but you could give it to someone else. So young people can be that gatekeeper where they receive the message and then they help, and they can say, I can go with you, I can share it, I can be there while you share it, but we need to do something because I care about you.
So how can, if somebody wants to get involved with mental health first aid, how available is it, and how can people find it?
It is available, and so Karen Coleman works for the Center for Healthcare Services. She's our mental health first aid coordinator, and so anybody that's interested, she's actually right back over there, and I'm sure they can connect with her and get more information. And if young people are interested in having this available at their schools, then we recommend that they also talk to their administrators, to their school staff, to say, we've heard about this mental health first aid, and we would like for us to have it, we'd like for the people who work with us to have it.
And so, Jim, how involved is the city with getting mental health first aid options out to people?
It definitely seems like it's something that the city is starting to increase, and I believe that there's a goal to get at least as many of our city employees that are outward-facing and working with the community up on this training as possible. So we're definitely starting to increase it, just seeing the benefits and that distinction of saying you can either be a support or you can be that person that directs them to a mental health professional.
So from what we've heard from Melissa, Emerald, and Michael, tell me what your thoughts and how much of an impact that somebody who's gone through, mental health first aid can do and help someone that's in crisis.
For sure, going through the steps, I felt like if someone was there to do that to me, it would help a lot. Back in middle school, back when I was going through a rough time, just listening and doing these basic steps of, hey, maybe we can connect to this adult. Because a lot of times, sometimes you don't want to open up to a teacher or your parents about it. So I always went to my friends, and either my friends come to me, and it's one of those things where at least now I know what are the steps I can take, the resources I can use and show to my friends.
Definitely having someone to listen, to turn to that's your age, and offering the resources, and just being there for them.
So I wanted to ask, is there anybody in the audience that has any questions so far? No, not yet. Okay. So the city, as Jem was talking about a little moment ago, the city council has been working with the funds that have come down from the federal government through it's called the American Rescue Plan Act. The city received around $326 million, and the council has spent the last several months trying to figure out the best ways to use some of this money, some of which is going to mental health. So Michael and Emerald, and Michael, I'll start with you. What are some of the things that you feel like the city would be able to do, or the Department of Human Services would be able to help out? What would you like to see be done as a result from this study?
First off, having the most resources we can within our schools, and especially outside of schools during non-school hours, because we're only involved in school for a certain amount of time, and then after that we're at our homes or we're out in the community.
For sure, like Michael said, we need something in our schools, or even this first aid training in mental health in our schools, because teachers, sometimes there are teachers with like an older mentality of, you can get over it, you're fine. But seeing that it is a problem and just opening an ear to it is very impactful. And like Michael said again, with the community, even if there's like maybe flyers outside or there's events going on, team building, those things really mean a lot to teens. Even if we can't always go to those things, it's nice to know that there are resources that's available, and even if they're cost-free, that would be amazing.
Do you feel like that y'all are seeing that mentality change? Since when you started doing this back last November, do you feel like that you're starting to see this conversation have an impact, that there's more attention now? Do you feel like that even since over the last, what's it been, 9 months since November, that there has been a change and a shift in the conversation or mentality of this?
Yes, there has definitely been a change on the mentality, especially of our mental health. The adults are recognizing that it's really important for us, the youth, because they work with us, like our teachers and community members, and especially our parents.
I think as well, like my immediate family, they're very understanding of mental health, but going out like further in to my cousins or aunts or tias, I know for sure, like telling them, hey, mental health is an important thing in our society today. Maybe you should listen, maybe you should just hear me out. And them actively listening to the conversations really made an impact, making me think that hopefully something went through, and hopefully they will listen to their kids or their future kids and see mental health as a normal thing to talk about, something that it's commonly brought up.
And Melissa, have you seen excuse me, have you seen like a mentality change, or have you seen more attention to this now that we have the results of this survey?
I think the results of the survey have helped, and I also think during the pandemic, people's awarenesses grew about how profound isolation can impact how we feel and our overall health. And so, yes, we've definitely seen an opportunity for us to talk more openly about mental health as just part of our overall health, and really helping people learn how to do things that will help them be healthier, and then also how to get help when they're not feeling well. It really is a continuum. We all operate on a wellness continuum with our overall health, where we go from feeling great to not feeling well at all to everything in between. And the key is always to intervene as early as possible when you first start to feel not well. And so with the conversations that are happening through the survey, through people now coming out of the pandemic and getting back into schools, I think there's more opportunity for us to promote healthy lifestyles and more opportunity to promote help, and that it's okay to get that help when you need it.
And I feel like that since the pandemic, we've seen people taking or realizing they need to have more time for themselves, or people encouraging others to take time for themselves? Because the burnout is real, and everybody experiences it differently. I mean, is that something that you've noticed since the pandemic? Have you seen people kind of get a better understanding of the impacts that stress and adverse effects on mental health have on people?
I think people have, like I say, a lot more awareness about what influences how well we feel. And I do see a lot more folks really, during the pandemic when people are at home, they started doing all kinds of activities that gave them joy. And that's one of the things that we want to promote. Everybody should have something and do something that brings them joy every day, whatever that is. If it's music, if it's art, if it's running, if it's yoga, whatever that may be, you want to have something in your life that you can do. And it doesn't always have to be something you have to pay money for. It can be things that you can do with very little resources. But one of the things people say, well, how do you know if somebody has a mental health challenge? And I say, that concept of live, love, or laugh. We all want to live, love, and laugh. We want to be able to go to school or go to work and be able to be successful there. We want to be able to be connected to other people in relationship with others, whether that's our family or our significant others or our friends. And we want to be able to have fun. We want to be able to experience joy and pleasure. And so when people aren't able to do that, that's an indicator that there may be a mental health challenge going on, when you start to not be able to live or love or laugh.
Can I ask you about some of the services that are available that are out there, especially for young people and adults? What are some low cost or even free resources for people out there that are in crisis?
So the crisis services, so if someone were experiencing a crisis, they're having thoughts of suicide, they're extremely agitated, just really struggling, then our crisis services are available. Again, we come out to folks where they are, or they can come to us. Then, of course, at the local mental health authority, we work with folks. If you don't have insurance, we will work with you to find a way to get you the services that you need. So those services could be counseling. It could also be what we call skills, where we teach young people how to navigate challenges, how to follow directions, how to advocate for themselves, how to ask for help. Asking for help is hard for adults even. We also work with other folks in the community, so there are a lot of other service providers that offer wellness kinds of activities. The National Alliance for Mental Illness has support groups and classes for people to participate in as well. And so there's lots of help available. We just need ambassadors to really help communicate where that help is and how to access it.
Well, let me ask you, how crucial is that, having people like Emerald and Michael encouraging people to get to these services? How does that change kind of the landscape when it comes to people's thoughts about the accessibility that some of these services, or being able to find some of these services?
So there are different services. Some are in the schools, some are in community. And so it really is about connecting people to the right service provider and the right method for that service. And so, our number is available. People can always call our intake and we'll walk them through that. The mobile mental health folks are out in some of the school districts now, and so they're providing education. But again, my experience has been young people talk to young people. And so having people who have that information readily available that can communicate that through young people directly is probably the best approach.
And this is a little bit off topic, but there was a creation of a new 3-digit telephone service, 988. Could you talk about that? Because everybody's familiar with 911, but when it comes to 988, if somebody calls that, what ends up happening?
So 988 is a crisis hotline. There are a number of them. So what we've had for years is a suicide lifeline, a prevention lifeline number. The Trevor Project is also a hotline available to help people who are experiencing a crisis, and that organization really specifically focuses on folks in the LGBTQ community. But 988 is a centralized opportunity to call when the crisis is a mental health crisis that's happening. And so the intent was that that's an easy for people to remember number. and so they could call that. But any of the hotlines that folks call, there are going to be trained professionals that are going to be able to help that individual get directly to the assistance that they need immediately or get assistance to them. And so that's the main thing, is we want people to be able to have in their phone or in their head, what is that number, so that I can call. So that if I'm in a bad space, I'm isolated, and I'm feeling like nobody cares, I know I can call this number and someone's going to answer it, and they're going to help me through this and get me to where I need to be.
So, Jim, what are some of the pathways that the city has and the Department of Human Services has when it comes to helping people access this, especially for folks that may not have the financial resources? Like, what pathways does the city have that can guide people to that?
Well, so our role with Department of Human Services is really just also speaking up the services that between Metro Health and the Center for Healthcare Services offer. Our job is to help promote those and connect people with them, because a lot of our services are people reaching out for support and other needs. And we're saying, along with whether it's, rent assistance, utility assistance, or any kind of like financial empowerment, anything else like that, we understand that there are going to be other needs available. And so we help partner with them in those capacities.
So, and what about people that may belong to certain groups? Because I'm thinking of someone I know that on occasion they have mental health crises, but they don't have insurance. They don't have the resource, the financial resources to go do private patient. This person I had recommended they go talk to the Pride Center, because they have similar, they have direction of that. Are there organizations out there, or what organizations are out there that for someone who just doesn't have that pathway yet to be able to be guided into services that would fit like their specific needs?
Absolutely. So at the Teen Mental Health First Aid Training, the flyer that they gave us has a QR code that scans and it goes to Sacred. And so that's a lot of delegate agencies all together, and it's so neat. It goes by zip code and by need, and you get to filter out the resources, and then you can also build on that to see if this is matching your need and what the closest resources are to you.
And so, Emerald and Michael, do you feel like that there is a change in the ease of access coming? Like for someone who may not know how to reach out, do you feel like from what we've been talking about today that there are more or will be more opportunities? Does this give you hope that there will be a change for people who feel like they may not be able to get the access they need?
It does give me hope. With technology, we have the technology in the palm of our hand, so it's a ease on where to receive information and how to ask for it.
For sure. One of the things is, in middle school, you would just have the hotline number, and that was the only number I knew of. And seeing that mental health is more of a common conversation, getting these resources seems way more accessible than it did back then. And hopefully, even for future generations or future people who are coming of age of teens, they can get these sources very accessibly or talk about it.
I wanted to open the floor to see if there are any questions that come up. Go through.
So it depends on the campus and the districts. I believe that there are some schools, high schools, that have kind of a peer outreach for folks that are having struggles. It may not just be exclusive to mental health challenges, but if they're having any kind of problems, which those other problems can also influence mental health. But I think it probably varies dramatically from district to district and campus to campus. But those are very successful where they're in place, because again, young people tend to go to young people first.
And then I think I saw another hand up here.
Absolutely. I think now that we're aware of it, one of the things that we wanted to do is consolidate more resources so that we can share this with counselors, because both counselors, schools, anybody who cares about youth or is working with them or just trying to figure this out for themselves, one of the things that we noticed as a gap was the fact that there's a lot of resources and people interested in helping, but those that are doing so don't necessarily have a marketing major, right? So part of our goal, both with the Youth Commission, Department of Human Services, and our partners with Metro Health, is making sure that we work with people so we can get this information out more, and especially when it comes to our schools and those that work with youth, making sure that we give a list of recommendations so that they have that and they don't have to search through Google and all the results that way. Thank you. But I mean, we'll be able to share that, and it'll definitely be something that we follow up with the school leaders that we work with. Thank you.
Any other audience questions? So we are getting a little bit close to the end of our time. Melissa, I wanted to ask you, what are some of the key objectives that your department's going to be working on over this upcoming school year? Any changes or any new programs that y'all might have coming out?
So our main objective is always to meet children and their families where they are and help them describe for us what is it that seems to be the problem and what are their goals for themselves. And so we work with them on those treatment plans, and then we provide the resources around them with both the caregivers and the kids themselves, the young adolescents or younger children in elementary, to achieve those successes. We don't always do it alone. We sometimes bring in other folks and connect them to other resources in the community. But our intent is that everyone's mental health should be as important as their physical health. And because they both influence the other. So we want to promote those services that are going to help people be well.
And Jen, is there anything that and I asked you a little bit about this earlier, but over the next school year, what do you see the Department of Human Services doing to reach out to people, to reach out to students more?
Well, we're going to be looking more at targeted marketing, just understanding that, when we invest in Instagram ads and everything else like that, we have a higher turnout and awareness. And so being able to do that versus just keeping it on the website is going to be a big thing. But I mean, with this, we're also looking at improving this so that it can be something that we do on a regular basis. I mean, 846 is great, but we know that if we do a lot more steps going forward, we can get a lot more buy-in from the schools, and then we can start understanding where the gaps of services are per district or per school district, and actually start improving and honing in that way, and making sure that they connect with the resources in the community.
And so, Michael and Emerald, some of the final thoughts I would ask from y'all. From when the results of this survey came out and you began talking to some of your friends, what were some of the things that they were telling you when they saw this? I mean, was there more of an understanding between each other? It's like, wow, there are people that feel exactly like I'm feeling right now.
I think one of the things was they're like, I don't believe it's 1 in 5. It's probably 3 in 5. Because it felt like a lot of us related to each other. It was a lot of, sitting down, one of our teachers spoke to us about it and was like, hey, seeing these results, how are y'all doing? How are y'all feeling? And seeing each other in the classroom saying like, we're all not really there. And having that support, even from a teacher, saying, it's okay, just take a day off. Let's talk about how we're feeling. And even when speaking to my friends, they're like, wow, it's nice to know that I'm not alone, and not wanting to talk about it is also a common theme between each other.
So with the results, especially the part of the results of not knowing where to go and find help, and if you have someone or not with you, so definitely the results and being able to share the resources at the end of our page is a great help.
Any final thoughts anybody would like to add?
I'm just really proud of the Youth Commission members that are here and have helped us so much, and with the Project Worth Teen Ambassadors as well. Like these youth-led organizations, UT Teen Health and Healthy Texas Futures, there's a lot of youth leaders that have really opened things up, and it's been incredible to listen to the subcommittees of the city, straight up asking for this when they developed these policy recommendations for ARPA funding and going forward. So this whole event is here because of the hard work that these folks did, and it's just been an honor to work with you all. So I'm just really grateful that this took place. Thank you.
Awesome. All right, everybody, let's give it up for our panelists. Thank you very much.